I think it's good afternoon, I almost said good morning. I want to thank East Texas Medical Center for having me and inviting me. I especially want to thank Becky. This is my second time to come here and talk, and I love coming to Tyler. What you do not know is that I got my master's degree from the University of Texas at Arlington and my PhD from the University of Texas at Austin. So I think my blood, instead of running red, probably runs orange. And I have to tell you a little story. When I first moved to Arkansas, and it's been 20 years ago now, my entire office was filled with Texas everything. And I got a little beanie baby in my mailbox, and it was an Arkansas Razorback hog with a little note anonymously that said, when you're in Arkansas, you have to love red, not orange. So anyway, it feels like I'm coming home when I get to come back to Texas. So, but I want to tell you that this is a privilege for me to be able to be here and talk with you today. Talking to groups of women is the reason that I do my research. I've never been prayed for, and I thanked Rosie for doing that. I do think it is a gift that God has enabled me to be able to do this research. I was telling some of the students when I first started off trying to get funding for this research, I was told I would never be able to get any funding, that I had to include men in my research. I have nothing against men. I'm happily married, have sons. But I said, no, I'm not doing that. I have to do this on women because we don't know anything about women's symptoms. And we had to get this done. And so this is what I'm going to be talking about tonight and a little bit at the end of this presentation today is the accumulation of some of the research that I've done. But I have been asked specifically to talk to you a little bit about high blood pressure today. And high blood pressure is indeed a risk factor for heart disease, so it does all go together. I'm going to start off talking a little bit about some of the facts about heart disease and some of the numbers that you need to be aware of. First of all, 75 million people, almost 30% of adults in this country have high blood pressure. And they're probably, some of them are lucky that they know they have high blood pressure. Many do not even know that they have high blood pressure. But that's 1 out of every 3 adults has it. And look at the number of women, and the latest one that I could find was for 2013, and I know that this number has increased dramatically. But for that year, over 38,000 women died from the results of high blood pressure. And only a little over half of the people that know they have high blood pressure and are being treated for high blood pressure actually have their high blood pressure under control. So just because you have high blood pressure and you're on medication does not necessarily always mean that it's under control. We also have another 1/3 of people that are what we call pre-hypertensive or pre-high blood pressure. And these people, if they don't modify risk factors, are going to join that group that have high blood pressure. And so you can see these numbers continue to grow. Now, women are just about as likely as men to develop high blood pressure during their lifetimes. But if you look at this, it varies by age, and you can look at the age groups and how it varies there. And women are lower in early age. But once we begin to reach middle age and then older, women begin to have more high blood pressure than men. And I'll be talking to you in just a moment about the top number and the bottom number on your high blood pressure. But women tend to have the top number get higher, what we call systolic high blood pressure. But it doesn't matter which number is up. We know that women begin to develop it as they age. Now, high blood pressure also really varies by race and ethnicity. And we know African American or Black people are much more likely to develop hypertension, and that this hypertension is more deadly in them for a variety of reasons. We know that there are some genetic indication of this, but there may also be other things going on that could be controllable. So we need more research done in this area. But you can see that almost half of African American women develop high blood pressure. It also is common in Hispanic people, and also in white individuals. Now, I wanted to look at what you've done here in Texas. And the East Texas Medical Center has been instrumental in gathering this information that I'm going to report to you. And I think it's very important that you understand what's going on in your own area, because this pertains to you and to your family members. And this is something we all can do something about. So when we looked at high blood pressure in Texas overall, you can see that about 30%, just like national statistics, have high blood pressure. And if we look at white, black, and Hispanic, just as nationally, you see that we have more hypertension or high blood pressure in African Americans or black individuals. And again, men have a little bit higher than women overall. Now, the Be Heart Smart, there was East Texas Giving Blood Pressure Screening Project, and this was done in May of last year, so not even a year ago. These are some of the statistics that they were able to find. And I've got I've got this slide and the next slide so that you can find your own county wherever you might reside or where some of your family members might reside. And I want you to look at the numbers. If you look at those that are pre-hypertension, that's the second column. It's bigger than those that are normal in the first column. And then you begin to add how many hypertension is a lower level, and then an increasing level for hypertension 2, and then hypertensive crisis means people are just about ready to have a stroke. And look at the people that they picked up just with this. And I will be talking to you about symptoms of hypertension. This is a big indication that these people are out walking around, coming in for a screening at a health fair, and these people don't even know they have hypertension. And some of these people were ready to have a stroke, and they still didn't feel bad. So I want that to be emphasized, even though I'm going to talk a little bit about some of the symptoms. This is the next group, some other counties, and you can see again the number that are pre-hypertension, hypertension, and then the hypertensive crisis. So 16 people were picked up with this screening that were ready to have a stroke. And look at the impact and quality of life that we were able to stop these people from having strokes and to send them back to their physicians to get this blood pressure under control. And I know I was talking with Becky earlier, and one of the people that was picked up said, "Oh no, I have high blood pressure, but I'm taking my medicine and it's under control," and had to convince this person it wasn't under control. Even though they were taking their medicine, it was not under control, and they had to go to the doctor or they could be having a stroke. Now, I always talk about awareness and hypertension medication. In the first group, shows you the people that are aware of hypertension, that they at least have it. The next group is people that are on hypertensive medication, and then look how the numbers decrease for the number that are under control. So people may be aware that they have high blood pressure. We have about 60 to 70% that are taking some kind of medication, but only about 40 to 52 or 3% are actually under control. So we have a long way to go with controlling hypertension. So I wanted to talk a little bit about what is blood pressure. We hear about it all the time, but people don't really know exactly what it means. And so I thought we'd take just a minute to talk about that. High blood pressure, or blood pressure, really is the result of your heart pumping and pushing blood through your arteries or your vessels. And I want you to imagine, let's say, a pipe in your house. I guess maybe they're not pipes, they're PVCs or whatever they are now. But anyway, it would be about this big around, okay? And they aren't elastic, but our vessels in our heart are. So they can close and expand and get bigger and smaller as we need, okay? What happens when we get high blood pressure? We get these risk factors like high cholesterol, diabetes, a variety of things like this. And what happens is we no longer have the ability to expand and contract. And so if you have a garden hose that gets kinked, and mine gets kinked all the time, and nothing irritates me more than that, and the water won't go through, That's what happens with us when we have a heart attack. We can't get blood through. But when we have high blood pressure, it gets firm, so it narrows. So instead of being this big, it might be like this big around. So you can imagine that your heart has to work even harder to push the blood through, because this is narrower and narrower, and our heart has to work harder and harder in order to get that blood through. And that is when hypertension gets higher and higher, our blood pressure does. And we have to have that blood to go to all parts of our heart because it carries oxygen. And so it becomes very important, and that's why the blood pumps, why the heart works harder, is because our body is saying we have to have this oxygen. And so it works harder and harder, and your pulse may get faster and faster trying to get that blood to all parts of our body that needs it. Okay, for your arteries to stay healthy then, it's important to keep your blood pressure in a normal range and to decrease these risk factors that we're going to be talking about very shortly. And for some people, as we've been talking about, it can get too high. And as we said, about a third, probably a third of people in this room have high blood pressure, just as about a third across the United States does. And it can cause very serious consequences. We tend to think about stroke, but we have other major diseases that can also be related to uncontrolled high blood pressure. Now, the blood pressure is numbered. As you all know, you have a top number and a bottom number. And the top number tells you how much pressure is being exerted against your artery or those vessel walls for pumping this blood. The bottom pressure tells you about when your heart is resting, because we all know heart goes dub-dub, lub-dub, lub-dub. And so that's what we're measuring here. And so we want to keep both of those numbers as low as possible. Now, this is how blood pressure is actually measured when you look at the numbers and what these numbers actually mean. Normal, your top number would be less than 120. Bottom number, 80 to 89, somewhere in that range. And as we age, blood pressure tends to creep up just a little bit, but it still should stay lower than these the pre-hypertension numbers that I have on here. Now, high blood pressure, the hypertensive stage 1, you can see, and we looked at that earlier, is 140 to 159 or 90 to 99 for your lower number. High blood pressure goes up, and the people, remember that were the 16 that were in hypertensive crisis, their blood pressure was over 180 when they came in for that screening, and they did not feel bad. So this is called the silent killer. How many of you in here know your blood pressure? You remember that. You have to know your numbers to know if it's going up or going down, just like you do for your cholesterol and your lipid levels. Okay, so what causes high blood pressure? I keep telling you we need to do something about it, but what actually causes it? Smoking, smoking, smoking. We can't help getting older, thyroid disease, adrenal disorders, lack of exercise, obesity, chronic kidney disease, drinking too much alcohol, and we hear a lot about excessive salt intake. And in the South and the central part here, we are very bad about salt. And it's not only our fault, it's salt in everything that we buy. And you really have to read labels to be able to do something about that. And certainly a family history of hypertension. Now, there are risk factors that you can't do anything at all about. You can inherit it from family history. You can't do much about your age. You can't do anything about your gender. Well, I don't think you can do anything about that. Some people are, but anyway, we'll move right on past that. And you can't do anything about your race, but we certainly can control some things, okay? Exercise, and I'm going to come back to this one again and again, and even though it says exercise, when I'm really trying to get people to do, American Heart has a wonderful saying, and if you don't take anything else from this talk today, choose to move, okay? And yes, absolutely. How many of you, when you go to Walmart or any big store, how many of you drive around trying to get the closest parking place? Okay, you can be honest, okay. And that's the worst thing you can do. You know, every time I park way out, I think, thank you, I'm going to do something for my heart today. Okay? My poor husband, he doesn't really enjoy walking, but he goes, I know, drive, get out here and park, and we walk. But it's the best thing that you can do. He and I also got each other for Christmas. Unbeknownst to each other, we each got each other a Fitbit. And you can do this with anything that you want to. But we're trying to get to 10,000 steps a day, which is the recommendation. And it's very hard to do. I sit behind a desk a lot. I'm not kidding. Sometimes at the end of the day, I go home and I don't even have 4,000 steps. Okay, so I have to really, really work at this. But we've been known before, because we always, it's called syncing, and we sync our Fitbits at night. And if we're close, we've been known to hop up out of bed, run around, try to get, because we're in competition with each other. But it's a good, healthy thing to do. And so you can make it fun. It doesn't have to be that you go to a gym, you know, and do all of this, you know, go out of your way and work at it. So choose to move. Remember that one. Diet. Lots and lots about diet, okay? Low cholesterol, less fat. We try to have a couple of meals a week that are meat-free, just vegetables and fruit. And once you get used to it, you really enjoy doing that. It's an easy way to do it. It doesn't take as much cooking, I don't think, so I enjoy that. And so, but think about how you could alter your diet a little bit to make it healthier. Fresh fruits and vegetables are an easy way to do that. If you use canned goods, select the low sodium variety, because that's the bad thing about canned products, is they tend to be very high in salt or sodium. So just choose, there's lots of low sodium options now that you could choose. Okay, you can control being overweight, obviously, by moving more, eating a little bit less. Sleep apnea is something that people don't think about, and we have not done a lot of research in sleep apnea in women, but we are beginning to get more research done, and it is just as detrimental to women as it is to men, and we need to have this treated. Okay, and we talked about alcohol. Certainly you can decrease that, smoking, and decrease stress. Now, these are the major risk factors for your area here in Texas. This is the metropolitan area around Tyler. And you can see some of the percents. And when I looked at this, it looks like the Tyler area is a little sicker than the rest of Texas, okay? Quote unquote. That just means you've got more things that you can modify to improve and decrease these risk factors. We've already talked about high blood pressure. You can see you do a little bit better with high cholesterol, which is very good, than the rest of Texas does. But diabetes is very concerning, and you are higher in diabetes here, and a combination of being overweight and obese. There are two different classifications, but you can see you're higher in this than the rest of Texas. And no leisure time physical activity, we've talked about that, moving a little bit. Smoking is a problem in the area and certainly needs some smoking cessation to go on here. And do okay with fruits and vegetables. Now, cigarette smoking is a big problem, not only in hypertension, but also in heart disease. And cardiovascular disease, as we call it, includes both high blood pressure and heart disease. So if I talk about cardiovascular disease, I'm talking about both of these two put together. But this is a very big risk factor, and in cigarette smoking and any kind of tobacco consumption is indeed. You can see our minorities are more likely to use cigarettes than the Caucasian people right now in Texas. And it's good to see these trends decreasing. I'd like to see them decrease a lot more. It is unusual to see more women using smoking than it is men. And unfortunately, a lot of these statistics reflect white young girls using smoking as a means to control their weight. And so we've got to get a better way to help them control weight rather than turning to cigarettes. Now, cigarette smoking is the leading modifiable risk factor for heart disease in women. It increases your risk by 700%. 700. And people develop heart disease on an average of 19 years earlier, smokers do, than non-smokers. So when I say it's a potent risk factor, I'm telling you it is an extremely potent risk factor. And as potent as this is, with people decreasing, do you know what they think is going to surpass smoking? It's going to be our obesity rates and sedentary lifestyle that go hand in hand. It's going to become as potent as smoking. We've got to do something about this trend. Now, obesity rates in Texas, you can see about 32% of people in this state are obese, would be classified as obese. Again, you can see our minority population is more at risk for this, and women are more at risk than men. So you could begin to piece together why our minorities may have worse outcomes and have more heart disease and higher mortality rates. Now, I talk a lot about being overweight and obese, and we tend to blame it on people, but I also want to blame it on our food industry. This slide doesn't show up really well, but I just can't help myself. I have to use it so that you can understand what's going on. Okay, today versus 20 years ago, a coffee would be 350 calories 20 years ago. And I'm sorry, 20 years ago it was 45 calories. Today it's 350 calories. So when you go in and order that Starbucks latte, or I love Frappuccinos, but I just don't let myself have them very often. But this is what we're drinking, okay? So look at that difference. And look at cheeseburgers. A cheeseburger 20 years ago today was essentially 250 calories. We load all this stuff on it now, 590 calories. And if you look at some of these ads, they've got bacon, they've got cheese, they've got, I bet those things are 1,000 calories. And people will go in and order a couple of them. And so look at what we're eating. And also, if you look at just common everyday things that we have in the foods, we have sugar added to everything. When you buy low-fat foods, look at them carefully. A lot of times they take out the fat and add sugar. And so you need to balance this out and look at low fat and low sugar, or you're going to be getting a lot of extra calories in. So that's just a word to the wise there. And your body mass index is how we actually put together your height and weight. And so this shows you what I mean when I talk about being obese or overweight, and that they get up above 30 BMI usually. 28, I think, is our cutoff. Now, I talked a little bit about high blood pressure and the damage that it can have on your health. This is what untreated high blood pressure, or not treating our blood pressure to a goal, meaning getting it in the normal range, it can lead to a heart attack, to heart failure, to stroke, kidney disease, major things. It's a leading cause of why some people end up on dialysis. So it's very serious consequences from high blood pressure that we must pay attention to. And my assistant, Beth Ann West, I said, I want to show them something visually about how we can stop this. And she devised this. She really makes me look good a lot of the times. And so she said, I made this. And I said, I love it. I'm going to use it in many ways now. So she has how people become inactive and they become overweight and they develop diabetes and high blood pressure. It's like this one leads to the next, leads to the next, leads to the next. And if you don't put behavior change in here and or medication in here, you're going to have a stroke or heart disease. I don't know any clearer way to tell you than that. We have to do this, change our behavior. Hopefully we can do that and not have to go on medication. But if we do, take it. So in order to maintain your blood pressure, you have to know your numbers, and most everybody in here knows their number. But a one-time reading, you have to watch how it changes over time. Sometimes people will go to the doctor's office, and we call it white coat syndrome because they're nervous, they don't know what's going to happen at the doctor's office. They may find something you didn't know you had, and your blood pressure goes up. Or some people walk really fast, they're late for the appointment, blood pressure goes up. So a one-time blood pressure, high blood pressure, doesn't mean you have high blood pressure. You need to get several readings and look at these trends. And so that's why you need to know your number, because you need to know what your next number is, and then your next number is to see what your trend is doing. We've talked about eating a healthy diet. This is a good way to get control. Fruits, vegetables, less sodium or salt. Read nutrition labels. And then quit smoking, limit your alcohol, and then try to get more activity in your life. We try to say at least 30 minutes. If you can get that a day. And we used to tell people they had to do it all at one time, and that's why people thought they had to go to the gym. But we found out with research that you can do 10 minutes here, 10 minutes here, 10 minutes there to try to get your 30 minutes in. And that's a nice, healthy way to do it. So now I told you that this is called the silent killer, and most people have no symptoms. But people sometimes have symptoms. But the symptoms I'm going to be telling you today, I want you to understand there are other reasons that you can have these symptoms. And just because you have one doesn't mean you're hypertensive. But I want you to at least be aware of what these are. Headache. This would be when you've not had headaches and you're starting to get frequent headaches, okay? Or the headaches that you have are beginning to get more intense. Vision problems. People begin to get blurry vision when their blood pressure goes up, okay? And some of these are the very same symptoms that you can have, we call them early warning symptoms for heart disease that women have reported. Irregular heartbeat can actually occur when your blood pressure is up. People can develop chest pain or chest discomfort. Fatigue or confusion, and I'm going to be talking about fatigue a little bit later. Remember when I said how hard your heart has to work when your blood pressure goes up? That's going to make you extra tired. They may actually have difficulty breathing because the blood can't get through all of your heart, and you might actually be going into a little bit of heart failure, and that can happen from high blood pressure. Some people talk about a throbbing, and other people will actually see blood in the urine, and this is from the kidney disease that can happen because of this. Frequent nosebleeds. Remember, there are other causes of this too, not just from high blood pressure, but if you begin to get 2 or 3 of these symptoms and you really don't know your numbers or you haven't checked it lately, you would want to be going in and checking this. And also you can get facial flushing. Blood spots in the eyes, you can have little tiny hemorrhages in the whites of your eyes, and some people get ringing in the ears also. So these are the most common symptoms if you have symptoms. But again, remember, it's the silent killer, and many people don't have symptoms, or if they have any of these symptoms, they attribute it to something else. Now I'm going to switch and talk just at the end here about heart disease in women, which is my real love to talk about. Most surveys are showing us that women are more afraid of breast cancer than they are of heart disease. Even today they are, even though 1 in 40 die from breast cancer, while 1 in every 3 die from heart disease. And think about that. Heart disease kills more women than all forms of cancer combined. And we don't think about it like that. The Komen Foundation has done a wonderful job of getting women to recognize and be aware and get checked for breast cancer. We have to do a better job, and this is a perfect example of helping women to get aware about heart disease in women. This is how we have to do it. But it kills 1 woman every 80 seconds. Think of the number of women that have died just since I've been talking. It's really astounding when you think about it. And this doesn't account for the number of women that have had a heart attack and will be disabled. Okay, I'm talking about just the people that die. But we know women are more likely to be disabled after they've had a heart attack than men. Now, this is our cardiovascular death rates by state. And I want you to see, Arkansas certainly looks a lot like Texas. I want you to find your area and see. It is a huge problem, especially in the South, the southern states and the central states in the United States. And a lot of that has to do with our diet. Now, I would be remiss if I did not talk about this in our minority women. It is the leading cause of death in African American women and kills over 48,000 African American women annually in the United States. And this is what you have to understand about sometimes in statistics things get buried. We are very happy to say that mortality rates or death rates from heart disease is declining in women. For years, it's been climbing. And in fact, there's a line that's like this and a line like this. Men's death rates have been declining from heart disease since probably mid-'80s, early '90s. Women's have been going up that entire time. And women's have just started to decrease. And now they're dropping dramatically. And I know lots of research has contributed to this. And I'm sure our research has contributed some, which we're all thankful for. But what's buried in that declining rate is that it's actually increasing in African American women in the age 34 to 44 age group. So their death rates are still increasing. And this has significant impact on our country. Besides the quality of life for them and their family, it has significant economic. They're not contributing to our economy. They're not being able to take care of their families. Lots of consequences. And so besides on the individual level, family level, that nothing can measure. But we've got to do something about this. Also, about over 48% of African American women 20 and older already have cardiovascular disease. I've had women as young, in my studies, I've had women as young as 28 who have already had a heart attack. That does not bode well for the rest of their lives or to have a long life. We've got to stop this vicious cycle. But only 14% of these women believe that cardiovascular disease is their greatest risk. We've actually done studies where we had women identify the risk factors that they have and then say, what do you think is the biggest risk for you personally? And they may have 5 risk factors over here. They won't pick heart disease. They don't personalize it. They still think it's probably cancer. So you have to personalize this message. I'm talking to you, each one of you, not just some global way. This is about you and about your life and your daughter's lives and your mother's and your aunts, etc. And the sad thing is only 50% of African American women know signs and symptoms of a heart attack. And it's not any better than that in most of the other races and ethnicities. Now, I know I've touched on obesity, but I want you to look at how obesity rates are changing in this nation, and this is why it may surpass smoking as the most significant risk factor. Look, in 1990, there isn't any red on there at all. 1999, we still don't have any red. 10 years later, look at that. The amount that we have, 25 to over 30% of people that are obese. And this continues to grow and grow and grow. We don't have any decline in this. And we've got to figure out a way in this country how to get this to start declining. And this is starting in our children. I've got friends at University of Alabama that are doing research in children and finding high blood pressure in children that are 3 years old. We can't let this continue. We have adult onset diabetes occurring in kids that are teenagers because of this obesity. We've got to figure out a way to change this. Now, the fact is, heart disease isn't always easy to diagnose in women. Mary did a wonderful job talking about some of the symptoms that she had. And just as Mary talked about with her second one, some women never experience any severe pain. It's one of the things that led me to do my research. And in our research, over 40% of women, even when they're having a heart attack, never use the word pain. One woman, I use her quote a lot, said, "It didn't even hurt bad enough to take a Tylenol." I had a woman that tried to jump off of her physician. She was in a physician's office. He said, "I think you're having a heart attack." And she said, "I jumped off of that table and I shook my finger at him and said, 'Quit trying to scare me.'" And he said, "You sit down, you're going by ambulance to the emergency room because you are having a heart attack." And she was astounded by this. So some women don't have these real severe symptoms. And if they don't, they delay seeking treatment because they don't recognize their symptoms. So I've spent a lot of my research trying to figure out early warning symptoms or prodromal symptoms that women might have before they have a heart attack. And these are the most frequently reported in every study that I've done. 60 to 80% of women always identify this unusual fatigue as the number one symptom that they can identify that was new prior to having their heart attack, okay? And this unusual fatigue can get so severe. I've got a classic quote from this one woman. She said, "I could not even make a bed. I would make half of my bed, I would sit down and rest, and then I'd have to get up and make the other half because I was that tired." It's unusual. It interferes with your ability to do your common everyday activities of daily life. That's the kind of fatigue, and it gets worse the closer women get to their heart attack. Okay? Some women might begin to notice it like 6 months out, but it gets very noticeable at least a month before their actual heart attack. Sleep disturbance. People they can go to sleep perhaps, and then they wake up and they can't go back to sleep. Again, there's other reasons for this. Menopause, we know, impacts women with their sleep cycle also. But these women in this study, we controlled for this, and we still had sleep disturbance. Anxiety, these fleeting feelings that they begin to feel anxious. And I think probably heart racing is one of their symptoms, that these are going hand in hand, and they get nervous over it and don't realize what's going on. Shortness of breath. They sit down and they rest a little bit, and this will go away. And this is not one of the most common. It's about 30% of women talk about some kind of chest discomfort prior to, during this early warning time, prior to actually having the heart attack. But if they do, they don't talk about it as pain. It'll be a little bit of pressure. Sometimes it's in the back, between the shoulder blades. It's not in the heart area at all. And frequent indigestion. Now, women, when they're actually having their heart attack, the most frequent symptoms that they talk about, and the one that brings them to the hospital oftentimes, is shortness of breath. Remember, they saw that in the early warning, but they could sit down and it goes away. When they're having their heart attack, it doesn't go away. And they begin to get some of these other symptoms added on. And here's this discomfort. It can be in the chest, it can be in the back, it can be numbness, it can be tingling, it can be pressure, and some women actually have pain also. So it can be any one of these, and feeling hot and flushed. Now, I really want you to understand that this whole thing is to try to get you to understand what your risk factors are, not only for heart disease, but also for high blood pressure. And this is a call to action for each and every one of you in here. It's never too late to protect your heart. Remember, 80% of heart disease is preventable if we just will modify a risk factor. So I want each one of you to think about one of the risk factors that you have that I've talked about today, and make a promise to yourself and a plan of how to change it. Whether it's parking clear at the end of the parking deck or wherever you go so that it makes you walk more. Maybe you want to get some way to measure your steps. Maybe you decide you're going to have a couple of meat-free meals to try to decrease cholesterol. You decide for you, but pick one. This is your call to action. And participate in research studies if you can. We still don't have enough women in research studies. In my studies, I will tell you, I recruited women from, remember I got my PhD in Austin. So I knew people all over the state of Texas. So I recruited from Dallas, from Austin, and from San Antonio. Okay, I don't know why we couldn't be recruiting women from here too. So there's lots of ways. If you find a study that you can participate in, do to try to help us learn more about this. That's why women have participated in my research. They say, I would do anything to try to help another woman to prevent her from having a heart attack. And that's what I want each one of you to do. Take care of yourself. Do whatever you can to try to help the female members in your family. So this is the easy way, ABC, way to prevention and treatment of heart attack and high blood pressure. Avoid tobacco, become more active. That choose to move is in there, and choose good nutrition. So I thank you very much for being such a wonderful audience.